In the criminal justice system of Miami, Florida, one of the syndromes that can affect people who have been imprisoned for a long time is known as Stockholm Syndrome. This psychological response occurs when prisoners or victims develop emotional bonds with their captors or abusers, sometimes even sympathizing with them and adopting their perspectives. This can make it difficult for them to objectively understand their own situation or trust the authorities trying to help them. For minors, the consequences of long-term imprisonment or solitary confinement are especially severe. In Florida, the use of solitary confinement for juveniles is high, and it has been documented that young people subjected to this practice often experience high levels of anxiety, paranoia, and depression. There is also a direct link between isolation and an increased risk of suicide among incarcerated youth. The lack of access to education, exercise, family contact, and rehabilitation programs worsens these negative effects, seriously affecting the emotional and psychological development of minors. When facing a judicial process, a minor who has spent a long time in prison or isolation may have difficulty trusting their defenders, communicating effectively, and may show symptoms of post-traumatic stress disorder. Their perception of authority and justice can also be distorted, which can negatively impact their ability to participate in their defense and understand the judicial process. Recommendations in these cases include avoiding the use of solitary confinement for minors, prioritizing alternatives to incarceration such as rehabilitation and mental health programs, and ensuring access to specialized psychological services. It is also crucial that minors have proper legal and emotional support throughout the process, as well as opportunities for social reintegration to help them overcome the trauma experienced in the prison system.